Hi, Mrs. Fisher. My name's Meredith. I'm going to be your nurse today.
Hi.
So what brings you in today?
I really just don't feel well. I've been throwing up. I have a fever. My stomach is so bloated. I haven't been able to go to the bathroom in so many days, and I'm just like in a lot of pain.
All right. So how often do you normally have a bowel movement?
At least once a day, if not more.
Okay. Can you remember the last time you had a bowel movement?
No, I can't. I mean, it's been a couple of days. I can't even remember.
Have you been able to pass any gas at all?
No, I wish I could. I think I would feel better.
Can you show me where your pain is? Can you point to it?
It's just all right here. Like, it's so swollen. You can see how swollen it is.
Do you remember when your pain started?
It started around the same time that I noticed I couldn't go to the bathroom. It's just really bad pain. I mean, a few days. I don't know. It kind of comes and goes in spasms.
All right. Do you have a history of GI problems?
Well, yeah, I have Crohn's disease, but this is nothing like what I usually have. It's a lot worse.
Okay. Have you ever had any abdominal operations before?
Yes, I had a tumor in one of my intestines that they removed. I had surgery. I don't remember where it was but I just know that I had it removed.
Okay, so you had a tumor removed. You've had abdominal surgery.
Mm-hmm.
All right, Mrs. Fisher. So I'm gonna lay you back, and I'm gonna take a look at your abdomen, and we're gonna see what's going on. All right. All right, Mrs. Fisher. I'm gonna lift up your gown and take a look at your abdomen. Okay.
Okay.
All right. Can you take a deep breath for me? Just gonna pull this down a little bit. All right. Can you take one more deep breath? All right. Good, thank you. The normal abdomen should be symmetric bilaterally. There should be no bulging or visible masses. When inspecting Mrs. Fisher's abdomen, I could see how distended it was, which is a sign of an intestinal obstruction. I also noticed Mrs. Fisher's uncomfortable demeanor upon entering the room. A comfortable person is normally relaxed and quietly sitting on the exam table. As I walked in, Mrs. Fisher was restless and constantly turning to try to find comfort. All right, Mrs. Fisher, I'm going to take a listen to your abdomen, okay?
Mm-hmm.
Five minutes later. Bowel sounds originate from the movement of air and fluid through the stomach and large and small intestine. Depending on the time elapsed since eating, a wide range of normal sounds can occur. Bowel sounds are high-pitched, gurgling, cascading sounds occurring regularly anywhere between 5 to 30 times per minute. Bowel sounds should normally be present. In the case of Mrs. Fisher, I could not hear any bowel sounds, which is abnormal and would be classified as hypoactive bowel sounds. I listened for 5 minutes in each quadrant and no bowel sounds were present. This is a sign of a bowel obstruction and is a medical emergency. All right, Mrs. Fisher, now I'm going to tap on your abdomen and hear what sound it makes, okay?
Okay.
All right.
I don't like that.
All right. Upon normal percussion, tympani should be heard. In the case of Mrs. Fisher, hyperresonance is heard from the gaseous distension in her abdomen. All right, Mrs. Fisher, now I'm going to touch your abdomen and see what I can feel, okay?
Okay.
So try to relax, deep breathe, imagine you're dozing off on a beach.
Mm-hmm.
First I'm going to go light, and then I'm going to go a little deeper, okay?
Ow. Ow.
Does that hurt?
Ow, yes.
Okay. Normal findings upon palpation of the abdomen would be non-tenderness. The abdomen would feel soft and there would be no muscle guarding. Mrs. Fisher's abdomen felt hard and distended and was tender upon palpation. She was guarding her abdomen and did not want me to even touch it. Okay, Mrs. Fisher, from the physical assessment that I performed, I recommend that you go to the hospital right away so that more tests can be run. From your symptoms, I suspect that you have a bowel obstruction, which is a medical emergency.
A bowel obstruction? What is that?
A bowel obstruction happens when either your small or large intestine are partially or completely blocked. The blockage prevents foods, fluids, and gas from moving through your intestines in the normal way. The blockage may be what's causing the extreme pain and bloating you've been feeling, and also a reason why you haven't been able to have a bowel movement.
It sounds terrible. No wonder I'm in so much pain. So how did this happen?
Well, you said that you had an abdominal surgery to remove a tumor in your intestines, and sometimes an adhesion can form during healing. An adhesion is essentially fibrous bands of scar tissue in the abdomen cavity that can form after surgery. You also explained to me that you have Crohn's disease, which can cause the intestinal walls to thicken, narrowing the passageways in your intestines. This can also cause a bowel obstruction.
So what's going to happen when I go to the hospital? What are they going to do?
Well, when you get to the hospital, they're going to run tests to confirm if you have a bowel obstruction. The doctor will order an abdominal x-ray, which will reveal blockages in the small or large intestine. The doctor may also order a CT scan of the abdomen, which will help the doctor to see if the obstruction is partial or complete.
Is that all they're going to do?
Well, if the tests confirm that you do have a bowel obstruction, you may have an IV placed so that fluids can be given to you. You may also have a nasogastric tube put in your nose that goes into your stomach, and this will suck air and fluid out to help relieve some of that bloating and like distension that you have. You may also need surgery. This procedure would depend on what's causing the obstruction and what part of your bowel is affected.
I'm really going to need surgery?
Well, you might. It's important to take care of whatever is potentially obstructing your bowel, because the obstruction can cause sections of the intestine to be damaged or even infarct, which means that part of the intestine dies. And it could also progress into hypovolemic shock, which is another medical emergency.
All right, I think I should go now.
All right.